Hi, in this video we are going to look at the vestibulocochlear nerve. So here we draw the diagram and show the vestibular nerve, and then we draw a separate diagram to show the cochlear nerve. So here are the two hemispheres, the pons, the medulla, and the spinal cord at the bottom. It has the left and right cerebellum as well. So we show here the cerebellum. And the lower lobe of the cerebellum is called the flocculonodular lobe. So here we show in green. And if we look at the vestibule has different membranous labyrinth or areas. Now, here we show the vestibule within which it has the saccule, the utricle, and the utricle is connected to ampulla, and this ampulla is connected to the semicircular ducts. Now, in these structures, there are maculae and cristae. From there, the fiber arise and it make the vestibular nerve. Now, the vestibular nerve will enter the brainstem at the level between the pons and medulla here. And then it will give the fiber to the vestibular nucleus. So here is the vestibular nucleus, and it has different parts or different nuclei. So here is the superior, the lateral, the inferior, and the medial nuclei of the vestibular nucleus. So some fiber will not terminate on the vestibular nucleus, and they will divert and go to the flocculonodular lobe, where it will supply the fastigious nucleus. Now, if we look at the two vestibulocochlear nuclei, they are interconnected with each other. So here are the interconnection between them. So here are the other three nuclei, the sixth cranial nerve nuclei, the fourth cranial nerve, and the third cranial nerve. Now, the fibers from the vestibular nuclei will go up ipsilateral as well as contralateral on this side as well as here. Or the same is for this nucleus. And these fiber going up will make the medial longitudinal fasciculus. And the medial longitudinal fasciculus interconnects the sixth, the third, and fourth cranial nerve nuclei, which is for the purpose when you want to fix your eyes on an object of interest. So it keeps your eyes fixated, and that's how it works. So the medial longitudinal fibers will go up to the thalamus. Here are the two thalami, and it will terminate on the ventral, posterior, medial, and lateral nuclei in the thalamus. And from the thalamus, it will give the fiber to the cortex. And this system also sends the fiber from the lateral nuclei of the vestibular system down to the spinal cord, where they will stimulate the neurons in the spinal cord, and that will send the fiber out to the extensor muscles, which are the anti-gravity muscles, and help you to stand up or do the activity against the gravity. So this was about the vestibular system, which is for the equilibrium and balance. Now let's look at the cochlear system. So here we draw another diagram where are the two cerebral hemisphere, the pons, the medulla, and the spinal cord. Now the cochlear nerve is for the hearing. So it takes the fibers from the organ of Corti. Now the organ of Corti is in the cochlea, and these peripheral fibers will go to the spiral ganglia here, spiral ganglia, and the central fiber will make the cochlear nerve. The cochlear nerve will go along the vestibular nerve, and here it will enter between the pons and medulla as well. And here are the two nuclei, the ventral and the posterior, interior and posterior nuclei. Now these fiber will give the fiber to these different nuclei. Now the ventral nuclei has interconnection between each other, and it is called the trapezoid body. Here, the trapezoid body. Now the fiber from the ventral nuclei will go up to terminate in the superior olivary nucleus. And the fiber from the superior olivary nucleus and the dorsal nucleus together will terminate in the inferior colliculi, and now they will make a track, and this track is called the lateral lemniscus. Now from inferior colliculi, the fibers will go up to the medial geniculate body. So if we draw the two thalami, and on the lateral side it has the medial and the lateral geniculate bodies, the fiber will go to the medial geniculate body, and from there it will go as a auditory radiation to the auditory cortex. So this is all about the vestibulocochlear nerve.